questions from the Board of Supervisors today about the effectiveness of mental health treatment in San Francisco and whether the city actually kept a promise it made back in 2021 to add 400 new treatment beds.
Yeah, ABC 7 News reporter Luz Pena has the latest for us. Luz?
Yeah, most treatment beds are not run by San Francisco. Instead, the city outsources this. They have contracts with private providers. Many are nonprofits outside of the city, and the city's budget committee has been waiting for this report since 2020. For 2 hours, San Francisco supervisors questioned the city's public health department, asking where are the treatment beds.
We have no idea, based on the numbers we're looking at today, how many San Franciscans with severe, you may know, or someone in your department may know, how many San Franciscans with severe mental health needs are in those as needed beds.
In 2021, the city announced a plan to add 400 new treatment beds for mental health and addiction treatment. Since then, the city has added about 350 beds of this type. Today, the city's health department said the expansion has led to a total of 2,550 treatment beds. But Supervisor Mandelman said their numbers may not be accurate.
They had a plan to add 400 additional beds. They believe, and they are telling us that they are close to having added those beds, but they have some key footnotes that are concerning to us. One is 15 to 20% of those beds may be unavailable because of staffing challenges.
The public health department said the staffing shortage is part of a nationwide staffing crisis for mental health professionals.
In terms of the intersection between impact of staffing on as-needed beds, we don't know that, meaning we apply for a placement, the facility accepts or doesn't accept, and we don't track if they're not accepting.
When it comes to getting treatment beds, San Francisco competes with other counties for access.
The competition is fierce. We have never replaced the state mental hospitals that have been closed. There are these private facilities that are sort of providing that service, but there aren't nearly enough of those beds for the needs of all the counties. And of course, San Francisco has a lot of need.
The Salvation Army's Harbor Light Center has 136 beds. The city funds 65 of those beds. They are urging the public health department to pay for more treatment beds within the city.
We have basically 50 to 60 beds open that the city could purchase today.
So you're saying they're empty?
They're empty. If they chose to do that, we could then fill up Harbor Light.
Supervisor Mandelman wants the city to change its plan for treatment beds.
I think we need to own more of those buildings ourselves.
And the need for treatment beds in San Francisco is climbing. And according to experts, the prevalence of mental health illness among the unhoused population across California is as high as 80%. Now, after today's committee meeting, supervisors are planning to request a follow-up with the Department of Public Health for more clarity. Luz Pena, ABC 7 News.